Did you know that right now, nearly 1 out of every 2 adults living in the United States has high blood pressure, and globally, over 1.3 billion people suffer from hypertension? What is even more alarming is that data published by the World Health Organization reveals that nearly 46% of adults with high blood pressure are completely unaware of their condition. High blood pressure is often referred to by cardiologists as a silent killer because it quietly damages your blood vessels, heart, brain, and kidneys for years without causing a single noticeable symptom. Every single second, your arterial walls absorb intense hydraulic force, causing microscopic tears and arterial stiffness. Yet, simple lifestyle adjustments and evidence-based dietary interventions can dramatically reduce your risks. The good news is that understanding how to lower high blood pressure naturally can help protect your long-term cardiovascular health. Before we explore these natural solutions, please remember that the information shared in this video is strictly for educational purposes and should never replace personalized advice from a qualified healthcare professional. If you have pre-existing cardiovascular conditions, severe hypertension, or are taking prescription antihypertensive medications, always consult your physician or registered dietitian before making significant dietary or lifestyle changes. Welcome back to Mindful Health Fitness. Today, we are deep diving into everything you need to know about high blood pressure. Tip number 1: reducing excess sodium intake and boosting dietary potassium. According to clinical data published by the American Heart Association, excessive sodium causes your body to hold extra water, creating immense fluid volume that strain your arterial walls. Research shows that keeping daily sodium intake under 2,000 milligrams or 0.07 ounces while consuming 3,500 to 5,000 milligrams or 0.12 to 0.18 ounces of potassium daily from natural sources helps your body excrete excess sodium through urine. What this actually means for your daily routine is that swapping processed foods for potassium-rich bananas, spinach, and sweet potatoes provides evidence-based support for arterial relaxation and blood pressure management. But this next dietary addition contains natural nitrates that dilate your blood vessels within just hours. Tip number 2: incorporating inorganic nitrate-rich vegetables like beetroot and leafy greens. Looking closely at clinical trials published by the Mayo Clinic, dietary nitrates are converted by oral bacteria and vascular endothelium into active nitric oxide gas. Nitric oxide acts as a powerful vasodilator, signaling the smooth muscles surrounding your blood vessels to relax and expand. Research indicates that drinking 250 milliliters or 8.4 fluid ounces of raw beetroot juice daily can lower systolic blood pressure by 4 to 5 millimeters of mercury. What this means for your everyday life is that enjoying fresh beet juice or a large salad with arugula and spinach offers science-backed management for chronic arterial stiffness. But this next daily movement habit reduces sympathetic nervous system tone and relaxes your heart. Tip number 3: engaging in regular aerobic exercise and isometric resistance training. Data published by Harvard Health Studies suggests that 30 minutes of moderate aerobic activity, such as brisk walking, swimming, or cycling, performed 5 days a week, significantly lowers resting heart rate at arterial pressure. Furthermore, isometric hand grip exercises performed for 12 minutes 3 times a week have been clinically proven to enhance endothelial function and reduce systolic pressure. What this means for your routine is that walking at least 5,000 meters or 3.1 miles daily provides evidence-based support for vascular elasticity. But this next restorative nightly practice is essential for resetting your body's stress hormones. Tip number 4: prioritizing quality sleep and stress reduction techniques. Research conducted by the Johns Hopkins School of Medicine highlights that chronic sleep deprivation of less than 6 hours per night elevates cortisol and adrenaline levels, keeping your cardiovascular system in a constant state of high alert. Clinical trials indicate that practicing slow, deep breathing exercises for 10 minutes daily, aiming for 6 breaths per minute, actively stimulates the vagus nerve and lowers blood pressure. What this means for your health is that establishing a restful 7 to 8 hour sleep schedule delivers science-backed management for nocturnal blood pressure spikes. But this next heart-healthy dietary pattern is world-renowned for reversing vascular inflammation. Tip number 5. Adapting the Mediterranean or DASH diet rich in omega-3 fatty acids. According to systematic reviews published by the National Institutes of Health, diets abundant in extra virgin olive oil, nuts, seeds, fatty fish, and whole grains dramatically reduce vascular inflammation and oxidative stress. Consuming 2 grams or 0.07 ounces of omega-3 fatty acids from wild salmon or flax seeds daily helps smooth blood flow through arterial networks. What this actually means for your daily meals is that replacing saturated fats with healthy plant oils provides evidence-based support for long-term arterial flexibility and heart health. But keeping your cardiovascular system healthy involves far more than just diet and exercise. Tip number 6. Limiting alcohol consumption and eliminating tobacco use. Clinical research from the Cleveland Clinic indicates that alcohol consumption elevates blood pressure by stimulating the renin-angiotensin-aldosterone system, while nicotine in tobacco immediately constricts blood vessels and spikes heart rate. Restricting alcohol to less than 14 units or 140 milliliters of pure alcohol per week dramatically improves vascular tone. What this means for your daily life is that avoiding smoking and moderating drinks offers immediate science-backed management against hypertensive arterial damage. Now let's look at how you can put all of these recommendations into immediate action. Before we finish today's guide, if you are finding this evidence-based health information valuable, please make sure to hit that like button and subscribe to Mindful Health Fitness right now, because your support helps us continue sharing life-changing medical research with viewers all across the world. To put these recommendations into immediate practice, here is your simple 3-step action plan. First, cut down on hidden sodium by eating whole, unprocessed foods and adding potassium-rich vegetables to your daily meals. Second, aim for at least 150 minutes of moderate exercise per week, combined with 10 minutes of daily deep breathing exercises. Third, prioritize 7 to 8 hours of quality sleep every night, while monitoring your blood pressure regularly with a validated home monitor. Now we want to hear directly from you. What is your current blood pressure reading, or which of these natural lifestyle changes are you planning to start first? Leave your thoughts and questions in the comments section below, and let's start a conversation. Thank you for watching Mindful Health Fitness, and we'll see you in the next video.